Welcome back to Isaac's Dentistry. This week we thought we'd go in a slightly different direction. You know, we've shown you around the office and we've explained the different procedures we do here in the office and giving you insight into the staff and who's here when you come to visit us, who you might interact with and who might be working on you. So today we want to take you kind of behind the scenes to a very important part of our practice, and that is sterilization and cleanliness, and how do we keep the instruments and our patients safe with what we do behind the scenes as far as keeping everything sterile and clean for all the procedures we're going to do. So we got Dr. Isaacs here again. Doc, why don't you go just kind of basically tell the folks out there why sterilization and the steps we go through are so important in all dental offices, but especially here in our office.
Well, there's been an evolution in sterilization and cleanliness over the years. I've always kind of talk about the older days. It's hard to believe, but back in the early '80s when I was learning how to do this, gloves and masks were recommended, but they weren't mandatory. Now I don't even walk into an operatory without gloves and mask on. So that's all that has changed, and that all came about in the early '80s. Well, I remember, what happened. That was the AIDS scare, the AIDS epidemic that just ravaged the U.S. and the world, and still is in many parts of it. We don't hear about it nightly anymore like we did, but it's throughout the world. It is certainly a force to be reckoned with. So what we've done, we now sterilize anything that can be sterilized. We sterilize it, and when I say sterilize it, that means we send it through. We use an autoclave here, so we send it through the autoclave, which is lack of a better term, it's an enhanced pressure cooker, and it gets hot. We were talking before. I think it's 270 to 300 degrees.
Right, and we're going to go back, and I'm going to show you exactly what Doc's talking about here in just a few minutes.
Sure, but just to kind of let you know, the AIDS virus left alone on a table. I think it goes half an hour. I forget all the stats now, but maybe a half an hour to an hour. Left out on the table. After it's laced with alcohol, I mean you're cutting it down to next to nothing, so you can kill it. The virus is fairly easy to kill, the AIDS virus, but the problem was that it's bloodborne, and once it gets into your blood, you can't kill that once it gets in there. Now there's other things that we do worry about. Hepatitis we worry about more than AIDS, but the AIDS got everybody treating hepatitis really seriously. Right. And I use this stat. Since 1983, I believe, there has not been an outbreak of hepatitis B from a dental office, it used to happen almost yearly, but now we're using gloves, masks, and everything's sterile. Right. So it's really changed. So yeah, we can, but it was AIDS that brought everything out in the forefront. Right.
And now I know we do have two types of sterilization. I'm going to show them in the lab here in a minute. We've got a cold sterilization and then our hot sterilization, the autoclave that you were talking about.
The cold sterilization is really a misnomer. It's not sterile. Sterile means you've killed everything. There's no bugs. There's no germs. There's no bacteria. There's no virus. Nothing can live in the environment that we create. A cold sterilization, we let our instruments soak for an extended amount of time, and it kills most things, but it's a disinfectant. It's not sterile. That's why anything we actually use invasively, we will be sterile. If we use it to cut, if we're using it for an extraction, it is sterile once we do that. But what's something that we would put in cold? Maybe a burr, maybe. What else we put in cold?
Our X-ray holders.
X-ray holders, something that's not going to be an invasive problem. So
right, it's a passive type of procedure, not an invasive procedure.
Exactly.
Well, I'm going to get ready to take folks in the back and show them these different steps and the types of things we use to do that. Anything that you want to add that would just kind of sum up what the importance and the amount of detail that we spend on that?
Well, it's important to the patient to know that we do take that extra step. Right. And it's not any, when I say extra step, it's not any extra step. Every dentist should be doing it. Right. And all of us, we're trained to do it at this point. So it's just taking the time and doing it and making it an office policy to do it. We never touch. There are certain things we don't do. We try not to touch something once we're sterile. Sometimes if my hands have been contaminated, I'll tell Scott, say, hey, can you get me? I can grab it right there, but I can't. I don't want to. I don't want to touch that drawer. Once I touch that drawer, then the drawer was never sterile, but now it needs to be disinfected.
Right.
So keep away from that.
And on those lines, we do a lot of things where I may not leave the room or the doctor might not leave the room, but we'll take a set of gloves off, do something, and put another set on. When we leave a room, the gloves come off, and when we go in another room, different sets of gloves come on. So changing our gloves repeatedly.
We never skimp on glove use.
Right.
For a long time, I didn't even want to know how much they cost because I'm going to use them, and I don't want that to be a deterrent. So I act like we use them when we need to. And we go through a lot of gloves here.
Yeah, and I'm really good about. I've used even today, our morning session this morning. I was in a room, never left the room, and I went through 3 pairs of gloves while I was still sitting with the patient. And again, that's things we'll do. I'm putting in a filling, I'll get things started, I'll take those gloves off to get my other materials, get it all ready to go, then I'll put more gloves on and start again. We don't want to touch the different equipment and the countertops, and like Doc was talking about, we don't want to get that drawer or something cross-contaminated, so.
Yeah, and we can, it's to protect us too. I've been blessed with a very good immune system, but I don't typically get sick. But we're the ones dealing with the fluid and everything. But if you treat everything like it's something you don't want to be touching, you won't have that. You won't because we're constantly touching our face and eyes. But if there's nothing on there, you're clean. So.
Yeah, and I think the big takeaway from this is, when you see us in a mask, when you see us in gloves, you see our pouches with our sterile equipment, it's not just for us, it's every bit as much for our patients as well, for them to feel comfortable and know that what we're doing is the correct way, the clean way, and the sterile way. So we're protecting ourselves, but we're also making sure we take care of our patients on an hourly and daily basis.
Exactly.
All right, well, let me take you in the back. I'm going to show you some of those sterilization techniques and some of the things we've done. Give you kind of a back peek into what goes on behind the scenes, so we're ready to go and treat you with the best care possible. All right, welcome back to our lab. So with our sterilization, it's usually a 2-step process. If we're doing our hot sterilization for what Doc was talking about, those things that are invasive, things that we're going to be actually using for procedures, what we do is we put it in an ultrasonic. So we have a cleaning solution, we put all of our instruments into there, and we run them for a minimum of 10 minutes. And it just vibrates the water and creates ultrasonic waves in order to knock some debris or clean the blood off.
It's a mechanical stimulation. Well, let me draw back. First we go to a brush. It's another mechanical. We use a brush with some disinfectant on it. Get rid of the gross matter. Just get rid of that. After that, then it goes into the ultrasonic bath for about 10 minutes.
Yes, sir.
And it vibrates and it makes a little noise. You kind of hear that thing. That's kind of like a little. It's like a little hot tub for your instruments, and it's just vibrating in there right now. So we've got some in there that the hygienists put in there, so they're going to get a double dose of this.
Yep.
But that can go. You can go ahead and turn that off. Kind of irritating noise. So then after that, then take it away, Scott.
Right. So from there, if it's one of our surgical instruments, one of our extraction instruments, those things that are very invasive, we've got these pouches, and I've got 2 right here because I wanted to show you. It's not enough to put it in one of our sterile pouches and put it into our autoclave. We actually have a determination to make sure that they did get sterile. So I don't know if you can zoom in here, Gary, but on these pouches you can see a little blue marking here. That's what it is prior to being used. And then once it's been sterilized properly, there's chemicals in that square that will change colors to black. Now, if we don't get enough pressure, we don't get enough heat, if something goes awry during the hot sterilization process, and we don't get that color, we know we need to re-sterilize and start over again. So this is, other than visually doing it and checking ourselves, we also have a backup system that makes sure and tells us and reinforces the fact that we have gone through the process correctly and that things are properly sterile.
Sure. And this is the one on the left is for heat, and that is ethylene oxide, which we don't use, and that should stay pink.
It should stay pink.
Yeah, because it's a chemical. It's a little different thing.
Right. So we go from the ultrasonic, brush it, get it cleaned up, put it in the ultrasonic, stimulate it some more, get the microscopic particles off as much as it possibly can for at least 10 minutes. We'll pouch it if it's an invasive piece of equipment. If it's a non-invasive, we won't put it in the pouch. And then we'll move over here to our autoclave. And this is what Doc was talking about. It'll heat up to about 270, 300 degrees, and it'll increase in pressure to approximately
20 psi.
20
psi.
psi, so pounds per square inch. So you've got that intense heat, that intense pressure, and that is what will sterilize our instruments. So
and it's not going to be kind of correct. It's not the pressure that you need, but you need the pressure to create the heat.
Right.
The heat is what kills the bugs. So if you just boil them, if you put them in boiling water, that's not hot enough. That's 212 degrees. It's 100 degrees Celsius. 212 will not kill it. There's bacteria that can live in boiling water.
Right.
So this is hotter than boiling, and that's what kills the bacteria.
Right, that heat
and the viruses.
Right, the machine will heat up so far, and then that pressure is what intensifies that heat and puts us over the edge on it. So we'll have two types of instruments. We'll have instruments that we pouch because they're invasive. They're going to get into your gums. They're going to get into the oral cavity and actually be very invasive. But things that we use on a general mirror. Okay, we're not getting invasive. We're not probing into the oral cavity. We're just kind of looking around. We don't pouch those, but they still go through the same process. They get scrubbed. They get ultrasonic. They get autoclaved. It's just we don't pouch them for the invasive procedures. Mm-hmm. And that's kind of
because once it comes out of the pouch, once we open that pouch, it's no longer, by definition, it's no longer sterile. It's sterile in there, it's disinfected, but it's not sterile, and as long as it's in the pouch. Except if the room's sterile. If you're a surgeon and the room is sterile and it's been certified sterile, you open it up, it's still sterile, but right. Because this room is not, that's why.
Right, and all offices, and especially here I'm speaking to our office, we take this very seriously. We may put a set of instruments into the room and never use them, but we've broken that pouch because we're expecting to use them. Well, when it comes out, it's getting scrubbed, it's getting ultrasonic, it's getting repouched and re-autoclaved. Even though it never touched the patient, may never have even gone near the patient. But as soon as we've broken that pouch, we will start at zero and go all the way through that process again, just to make sure that we've got all of our bases covered every single time.
If the pouch is broken, it's no longer sterile.
Correct.
Right.
Correct. So that's our basic process. It seems basic, but as simple and straightforward as it is one of the more vital aspects of what we do in a dental office and here at Isaac's Dentistry. We thought you'd like kind of a behind-the-scenes look to know that you're being taken care of before you ever sit in our chairs here in the office, before you ever walk through the front door. We're thinking safety on all levels and making sure that the care we're providing is with the best, the most sanitized, and the most care can be taken to make sure that you're safe from the moment you arrive to the moment you leave. Anything before we let the folks go, Doc?
Sounds good, Scott.
All right.
I think you covered it all.
Well, thank you so much for joining us, and we'll see you next month here at Isaac's Dentistry. Thank you so much.